I'm Karen Kendrick with the Texas Hospital Association. Maternal health is a problem all across the United States. And here in Texas, maternal morbidity and mortality is among the worst. That's why the Texas Hospital Association has partnered with the Texas Department of State Health Services for the TexasAIM initiative.
TexasAIM is allowing us to partner with hospitals, providers, teams across the state to really look at opportunities to improve outcomes related to obstetric hemorrhage and in the future preeclampsia or hypertension in pregnancy.
Two things that are really great about making this a priority and being a part of TexasAIM that are going to be great for our community and our hospital as a whole is one, just recognizing the rates of morbidity and mortality so that then we can focus on how to improve them.
When we started the AIM bundles, there was really very little money put behind that, but hospitals jumped right in and said, we want to do better, and they did.
So we've had huge engagement and participation from the hospitals in Texas in AIM. It started and ramped up pretty quickly, and now it's 97% of the hospitals. Meeting with them and interacting with them, their enthusiasm is not like anything I've ever seen.
They're coming to our in-person learning sessions. They're participating on our action period calls. They're really digging in and doing the work that is necessary to really implement these bundles and make change within their hospitals.
What we've got with our first rollout package with the obstetric hemorrhage is if we have a patient who does come in and does have that hemorrhage, we've got everything available to respond much more rapidly than we could have before.
When there's an emergency, the nurses come flooding in and they work extremely well as a set of nurses. With AIM, it really requires that physicians and other staff members also work together, so that response team expanded.
I think it's been a great way to partner with other hospitals as well, because we're all working towards the same goal. When it comes to taking better care of moms, it's not a competition. What hospital has the, better this or better that. It's what can we all do to help each other out.
Oh, this works great for me, and well, we tried that, but it didn't work very well. And I think that it's really helpful for us to see what other people are doing. There's people from all over, and you can pick and choose which things somebody's doing that would really help you.
I've been in OB for 23 years now, and you think that you're aware of everything that can happen, and you are. You have the experience behind you. But when you start discussing it and you bring that to the forefront, and then you have your colleagues here and the other hospitals, it kind of helps you to think about the things that you've always done just in robot motion.
A lot of nurses may not truly understand the physiology of a hemorrhage and what's happening and how the massive transfusion protocols work, and TexasAIM is taking it as the first one and providing education.
My particular hospital has been doing the postpartum hemorrhage bundle since about 2015, and it was a very impactful process for us. It took us about 18 months to roll it out, and we saw a very significant decrease in our significant hemorrhages and transfusions and ICU admissions.
We do present it at department meetings and let people know what's actually going on, but also through simulation participation. As more people have gotten involved in the actual simulations, they've learned what's happening.
Currently, we're doing a debriefing on adverse events, near misses, and also for close calls. So that's helpful to allow input from other departments, all the staff, including the nurses and physicians.
For us, we had already started some preliminary work, but it required us to go back and to refine our processes and to look how we could get stronger and where we had gaps. So we reconvened our task force and started looking at our data in a different way, which has had a big impact on education for our physicians and our nurses, and making sure that we're all utilizing the protocol that we have in place the same way every time. So standardizing our processes a little bit better, I would say, is the biggest impact that it's had.
I think we need to keep this momentum going. I think Texas will spur other states to adopt this as well.
I think that it highlights the importance of the work that we're doing here to reduce maternal morbidity and mortality throughout Texas, so that the administration is aware of the problem that exists and what the work is and the resources that are required.
Losing one mom that you don't have to is devastating and should never happen if you can help it.